Good afternoon. My name is Christy Matheson, and I'll be your moderator for today's press briefing. Before we begin, I'd like to introduce the Premier of Nova Scotia, Stephen McNeil, and Nova Scotia's Chief Medical Officer of Health, Dr. Robert Strang. Go ahead, Premier.
Thank you, Christy, and good afternoon, everyone. It's been 2 weeks since our last briefing. In that time, we've announced 10 new cases of COVID-19. Some have recovered, and currently we have 5 active cases. They are all related to travel outside of the Atlantic bubble, and once becoming symptomatic, the individuals were tested and are now isolating. It's another sign that COVID is never far away and that we have to continue to be diligently and follow the protocols. Keep your distance, wash your hands, wear a mask, and stay home if you're feeling unwell. And do the online self-assessment to determine if you have enough symptoms to require a COVID test. If you do, and you live in the central zone, starting today, you'll be able to book your COVID test online. The rest of the province will start in mid-November. The goal here is to reduce the wait times to give people their results sooner. It should take about 10 minutes to book your appointment. That means you will get your test sooner. And if we are more efficient on the front end, we will be better able to detect COVID, track it, and manage the number of cases in our province. Dr. Strang, I'll turn it over to you. Tell us more about the new testing model.
Thank you, Premier, and good afternoon, everybody. As always, I will start today by giving an update on our cases of COVID here in Nova Scotia. We have no new cases today. And since our last briefing on October 14th, we've announced 10 positive cases. 9 of those are related to travel outside of Atlantic Canada, and the other case was a close contact of one of these travel-related cases. Of the 10 cases, 1 of them was diagnosed and recovered in another province, but because of the rules of how we report cases, that they were a Nova Scotia resident, so that case is attributed to us and is one of the numbers. And we want to make sure that people understand that, because that is an additional case appearing in the numbers we announce publicly. So it's not unexpected that as we get more COVID around us in other parts of Canada and other parts of the world, we will get more COVID coming here. That's why we need to keep focused on doing what has kept us safe to date. As of today, Nova Scotia has 5 active cases of COVID-19. We have nobody in hospital. And our cumulative numbers are 1,102 overall cases of COVID-19. 110,079 people have been tested with a negative result, and we've had 65 deaths. And yesterday, the Nova Scotia Health Authority's labs tested 861 people. As the Premier has said, now that we have online booking for COVID-19 testing that is now available in Central Zone, and in the next couple of weeks in other parts of the province, it's an important reminder to Nova Scotians that if they become unwell, that they take the online self-assessment, and that's at 811.novascotia.ca. And if as I said, in Central Zone and soon in other parts of the province, if it's recommended that they get a test, they can go right away and stay online and then book their own appointment for that test. It's quick and simple to do, and will speed up the whole process. We do know that not everyone will have access to technology and the internet, and for those who don't, that calling 811 will remain an option for those individuals. But certainly if people do have online access, we strongly encourage them to use that online process. It's important for people to also know that the self-assessment they go through will direct them to call 811 for an in-person telephone clinical assessment if the type and severity of their symptoms indicate that is needed. It's important people understand and have the reassurance that if they need an urgent assessment, the online assessment will take them and tell them and direct them to call 811, where a nurse will then take them through the usual 811 process. Moving on to international students, as you're probably aware, yesterday there was an announcement that we will resume welcoming international students to our post-secondary institutions and private language schools starting early in November. The students will be able to return to these institutions that have been approved and appear on the Federal Immigration, Refugees and Citizenship Canada Designated Learning Institute list. there will be strict public health protocols in place, and this is the process we've gone through, my office working with labor and advanced education and with these institutions to make sure that we have a safe return and a transition of these international students into our province. So the institutions are required to provide students with comprehensive information about the travel requirements, the quarantine and other health requirements before those students ever decide to come to Canada. Once they get here, they are required to self-isolate for 14 days, and the institutions must have a detailed protocol in place to support those students all the way from getting them from the airport to either a hotel or another living arrangement, and then to monitor and support them in that 14-day quarantine. Very similar to what was done with university students back in August and September. So the federal designated learning institute list, which they update it every 2 weeks, so the next update is expected November 3rd, and we expect that will now start to include all the approved Nova Scotia institutions on that. For private K-12 schools, the Department of Education and Early Childhood Development continues to work with them. I'm involved in those discussions to make sure that if those private schools want to bring in international students, that they can do that following the same safety protocols. And so we continue to work through that process. I want to move on to what I call non-essential travel or tourist travel. Because we know that as things start to get a little colder and people start to see the holiday season approaching, that at least some Nova Scotians may be starting to think about travel to warmer destinations. And certainly recent media stories about a possible Atlantic Cuba bubble highlight this. But we have to remember that there are many countries around the world that are in or starting the second wave of COVID-19. Canada is included in that. And if there's one thing we can learn from the first wave, it's that this second wave is not going to go away anytime soon. It's not going to be here for just a couple of weeks. We can expect it to be for at least the next 2 to 3 months. There are no guarantees where we might be with COVID here in Nova Scotia during these coming months. And we really don't know with any certainty what 2021 is going to bring, either locally, nationally, or internationally. The Public Health Agency of Canada continues to advise against non-essential international travel. And under the Federal Quarantine Act, international tourists will be required to complete a 14-day quarantine upon arrival in Canada. So while we remain in the middle of a global pandemic, I think planning to stay close to home, enjoying the unique experiences that all 4 seasons bring in Nova Scotia, and choosing to support our local hotels, restaurants, and other businesses is the safest and wisest choice for Nova Scotians to make. And I'll finish up with a holiday update. We've seen in reports in the last week or two from other provinces about the impact of unsafe social gatherings and how that has been driving their local COVID-19 transmission. And to me, and hopefully for everybody, this is a clear reminder of the need that we all understand and follow gathering limits, physical distancing requirements, mask wearing, hand washing, and staying home if we're feeling unwell. I've had lots of positive stories about people and families observing Thanksgiving with family and friends and doing it safely. And I want to thank everyone for this and for putting the safety of others and your community first and demonstrating that you still can have gatherings, you still can get together with family and friends, but doing it in a safe manner. So Halloween is coming on Saturday, and I do want to wish those who choose to participate in trick-or-treating or giving out treats or other ways that they enjoy Halloween, I wish them a safe and fun occasion. We do have detailed guidance on safe Halloween for children and adults on our coronavirus website. So anybody who doesn't know that by now, novascotia.ca/coronavirus. But there are a few key things that I want to remind people of around starting with trick-or-treating. That if you're not feeling well, just stay home. Don't participate. Kids, watch your numbers. Go up in groups of up to 10, and make sure you're keeping the distance, 2 meters or 6 feet between groups. Make sure your hands are clean and watch where your hands go. We're recommending, instead of putting your hand on a doorknob or doorbell, a light rap with your knuckles on the door. Both for kids getting treats and people giving out treats. We don't want multiple hands going in a common bowl. So if you're using a common bowl or something, use a pair of tongs or put out individual servings. It's important that we don't have lots of hands going in the same place. If you're trick-or-treating indoors in an apartment or something, we recommend that the kids include a non-medical mask as part of their costume. And if you choose not to give out treats, just turn your lights off, put up a sign, make sure it's very clear, and so people who are trick-or-treating will just avoid your house. And for adults who choose to create a party or an event out of Halloween, sticking with gathering numbers and the other safe socializing measures is key. If you're in your home, there can be a party of no more than 10 people. And the same is for restaurants, licensed establishments. You can go out, but in groups of no more than 10 sitting together. There can be larger community gatherings of up to 50 as long as physical distancing is maintained between the individuals or established family or close social groups of up to 10. And in recognized businesses and organizations, they can have up to 200 people indoors or 250 people outdoors, again, as long as physical distancing is maintained between the individuals or those established groups of up to 10. A reminder that non-medical masks are required in indoor public places, and a Halloween mask doesn't count unless it is a non-medical mask that is covering your nose and mouth. And even if you got great plans, if you're feeling unwell on Saturday night, stay the blazes home. And as Halloween comes and goes, we'll soon be turning our attention to other civic and festive holidays. Remembrance Day will be here in a couple of weeks. Christmas and other religious holidays such as Hanukkah are only a few short weeks away. We will be providing more specific guidance about those events those times in our calendars will be coming out soon. But the most important thing for people to remember is that we need to continue to focus, even as we move through each of these festive events in our calendars, that we need to focus on what we can do to keep COVID-19 activity low in our province. How we socialize for the immediate future is all about how we socialize safely. In Nova Scotia, we've created safe environments in restaurants, licensed establishments, and other public settings for people to gather in their close group of 10. We have events such as concerts and sports returning, and with the use of clear protocols to provide the necessary level of COVID safety to hosting larger groups. I encourage people to take advantage of these opportunities. And if you choose to socialize at home with family and friends, then by all means do so. But sticking with groups of no more than 10, limiting the number of different close social groups you are in, being careful about how people who are at increased risk of severe disease are included in those groups, avoiding groups and events if you're unwell, observing hand washing, cleaning common surfaces, safe food and beverage service protocols are all critically important. We can socialize, and this is important for our health and well-being, but we can show we care for each other, for our community, and for those who continue to provide health care and other essential services by socializing safely and using common sense. Don't let your Halloween party, Remembrance Day ceremony, or holiday function be the reason for an outbreak of COVID-19 here in Nova Scotia. Premier.
Dr. Strang, over to you, Chrissy.
Reminder, we'll take one question and one follow-up from reporters in the amount of time that we have allocated for today. First question will go to CBC's Mike Gorman.
Dr. Strang, as you probably know by now, there was some concern at the shipyard yesterday, workers there related to a worker from Quebec who was given a work exemption to come. Your office has given many exemptions over the past few months, and as far as I know, that's not created any great problems. But could you please speak just a little bit about what considerations go into whether or not you would grant that type of an exemption, and perhaps what people in work environments who find out somebody from away has been granted that exemption ought to know about what's going on with that.
Yeah, so we have a specific process for what we call essential workers. So if a business, including the Irving Shipyard, has work that cannot be done by people here in the Atlantic Canada, and there's lots of specialized pieces of work, installation of a certain piece of equipment, maintenance of equipment, those type of things, we now actually have an exemption right in the public health order, that as long as they agree to follow a very clear protocol, and that protocol really consists of maintaining as much distance as possible from anybody else in the work site. So we call it work isolation. And if they can't maintain distance, very strict protocols around masking, hand washing, all those kind of pieces. And then when they're not at work, they have to be under strict isolation. So essentially, they usually stay in a hotel. They'll be staying in a hotel room, meals delivered, all those kind of pieces. Those are the protocols that we have in place that a business has to agree to follow if they're going to bring in one of these specialized workers. It's important for all businesses, and this was the case yesterday. We did have our occupational health and safety inspectors were down at the shipyard yesterday right away. It was a communication issue. So an important piece of this, it's a reminder for all businesses, if they're bringing these type of workers in, it's important that every worker in that work site understands and knows the protocols that are going to be followed to keep everybody safe.
I don't know that any of these exemptions have led to positive test results, so I wonder if perhaps you're aware of whether or not any of those have. But just further to your comment on communications, do you think that an employer ought to make workers aware of the fact anytime an exempted worker is brought onto the work site, and what is being done to accommodate that situation?
So two things. We have had no cases that have resulted from an essential worker coming in. We do all the follow-up on all our cases, and we've had a number of these. This has been happening since the spring. Businesses are aware they need to get work done, but they're also very aware they need to create continue to have a safe workplace. And we've had no cases result from that. Clearly, our expectation as part of this that a business would make sure that they're communicating within their work site. That's their responsibility. That has been made very clear with the follow-up of the inspection yesterday to Irving, and we have the same expectation for every workplace.
Next question will go to Radio Canada's Olivier Lefebvre.
Yes, Dr. Strang, I'll follow up on the questions of my colleague Mike Garman here. I want to understand if workers that would not be comfortable with people coming in from other provinces that was granted an exception to work, should those workers not comfortable should be permitted by the employer to stay home for a certain time, for example, if they have someone more at risk in their close circle at home?
So that would be a discussion within the workplace between employer and employee, following the occupational health and safety rules. But certainly we don't allow this to happen casually. There are very clear protocols, and I've been through a lot of these in detail, that the companies are well aware of the need to follow these protocols, maintain worker safety. And so the work isolation protocol is all about keeping the essential workers as separate as possible from other workers in the workplace. And if they can't be fully separated, then making sure there's masking and other protocols in place. But like any occupational health and safety issue, if a worker feels that they're potentially put in an unsafe position, there are processes within workplaces to deal with that.
Thank you. I have a question from a colleague here. We've heard from teachers that some of them are already reaching burnout stage, are considering retiring early because of the lack of resources in school as they try to do their job in a pandemic. Maybe this question's from the Premier. What additional tools and support are you offering to help these teachers?
Well, first of all, I want to thank teachers across our province who continue to adapt with a new learning model, with the idea that we are in a pandemic. As you know, we've continued to invest in public education in classrooms across this province. This is obviously a new way of learning. But I also want to acknowledge all frontline workers who've been working through this pandemic to the best they can. We know there are stresses added to it. It's why we've added extra supports. We will continue to do so as we find our way through it. And we've been fortunate that Nova Scotians have continued to follow the advice of public health and follow the protocols. And we've been able to keep the virus low. And we'll continue to do that. And as I said earlier, the Minister of Education will work through that with his partners, as the Minister of Health will work through with his partners, as the Minister of Community Services will work through with her partners, all of whom are frontline workers and are dealing with the issue of the pandemic.
Next question will go to All Nova Scotia's Lindsay Armstrong.
Dr. Strang, considering testing, have you considered the option of testing widespread at the border, and would our testing capacity be able to manage that? And if we were able to implement some kind of widespread border testing, would that be able to shorten the quarantine period?
So we're certainly been looking at that. Our first priority has been and remains making sure we have access to testing for anybody who has symptoms, and making sure that they have the timely turnaround of their results. And those, as we've talked about, moving things online, and we announced several weeks ago, that has been the focus of the attention of the health system, is making sure with that timely turnaround and access for people who are symptomatic. We've always had on our list that once we get the first piece done, we need to think about what ability we have to test people who do not have symptoms, and what role testing at the border might play. So we're looking at that now in a more detailed way about what might be what we might be able to do within our lab capacity. We have new types of testing. Point of care testing, which is becoming available. That testing has limitations. So we're looking at all of that, and part of it is that what role could that do to perhaps reduce or minimize or change some of the quarantine requirements. So that's, I guess the short answer is, lots of active discussion on that right now.
Looking at our testing capacity, there was about under 850 tests done yesterday, and we're aiming for 2,500 by mid-November. How are we going to reach that full testing capacity in just a couple weeks?
So the next steps are, it was critical, was getting some of the online pieces done. First of all, online self-assessment, online booking. The health authority is in the process of also building, additional capacity in the primary testing centers, where they're increasing hours, increasing the number of people that are there for testing. I haven't had an update yet. I don't believe it's in place yet, but we're putting in a piece of equipment at Cape Breton Regional Hospital, which will be able to do about 400 tests a day, which will add to that capacity. We're increasing the investment in some of the transportation of specimens. So all those pieces are in place, and that my understanding is that once we get to middle of November, we'll have that capacity of up to 2,500 tests a day, as we put all those different pieces in place. I can't say for sure where we are at today, what our capacity is. We said it's probably, we're getting close to about 2,000 tests a day, and then we can go 1,800 to 2,000 a day, and then the plan is by middle of November to have upwards of 2,500 tests a day, the capacity to do that.
Next question will go to the Herald's John McPhee.
Dr. Strang, could you talk about, provide more details about the online booking move? Why this move at this particular time? Is there a backlog of testing requests? Just talk about that move a little bit.
So there's two pieces. There's been a longer term project, which has been to booking all lab tests and diagnostic imaging, X-rays, etc. The health system is moving to build the capacity to move all of that online. That work was started before COVID, and that work continues, and we're close to being able to implement that. Shorter term, we were actually then piggybacking on that bigger opportunity to add in booking making an online appointment for your COVID test. It only makes sense to include it like any other lab test. But also, as we went through the COVID process, what people have been having to do was, first of all, phone 811, but even up until today, when they were doing the self-assessment, they then had to then call the booker, and you'd have to leave a message, and then the person would phone you back and make an appointment. All of that takes time. So moving it to online as part of this bigger project, like everything else, it just makes it faster, that you can go in there and then you don't have to wait to get a call back. You don't have to wait online for somebody. You can just make your own appointment. It's much faster and efficient. And then the system is set up, and then you know where to go and for to get your COVID test done.
I see. So just to be clear, people can't just go on the online booking site and make the, okay.
You have to go through the self-assessment first. If you're screened in and say you need a COVID test, then you can go and book your COVID test.
This is a question for either the Premier or Dr. Strang. There have been concerns expressed about people renting Airbnbs and not self-isolating as required. We've been following a situation at Martinique Beach where there's a group of surfers from Quebec who, neighbors say at least, are not obeying the protocols. Should the province even be allowing short-term Airbnb rentals at this point?
I mean, that's a bigger question, but we certainly, I mean, people are allowed to come into Nova Scotia, or they're allowed to come in, rent a hotel, that we're not saying no to that. They just have to follow certain rules. I continue to have discussion with chiefs of police, and I had it last Monday, had a discussion with them about they're part of the team, and that when we have concerns around non-compliance, whether it's gathering numbers, whether it's adhering to isolation requirements, the police are the ones that are then have that enforcement responsibility, and so we continue to have that discussion. The chiefs of police are well aware of that, and they continue to investigate. So the RCMP was involved in this investigation that was in the news yesterday. And nothing's perfect, but the vast majority of situations, people are adhering. If we look at all, as I've said before, all the cases we've had since June, the majority of them have been people who have come in and have done the right thing and have stuck with their quarantine period, and because of that, they haven't had wide community spread. There are certainly cases where people haven't been, but I firmly believe that that's the minority. And then we work with our police colleagues around the enforcement aspect of that non-compliance.
Next question will go to CTV's Natasha Pace.
In terms of the international students arriving starting next week, I know they have to self-isolate, but originally when universities started back up, the students from outside the Atlantic bubble had to have the 3 COVID tests. Why is that not being done, or is it being done for the international students?
It's not. The reason we chose testing is because we were having a large volume of students, up to 4,000, in a very short period of time. And we put together the process of them having to have a quarantine plan, monitoring and support by the university and community, as well as testing. The international students are a much lower number over a much longer period of time. So we didn't feel that it was necessary to bring in, to supplement quarantining with testing. The most important thing, and what prevents minimizes the risk of any transmission, is adherence to the quarantine.
Also, I guess maybe for the Premier, I know there's some concern about students who are leaving over the Christmas holiday break and going outside the Atlantic bubble and then returning. Are you concerned at all, or are you looking at putting anything in place around that to prevent COVID numbers from spiking in the new year?
So we're going to continue to work with public health. We will send protocol. As of today, they will follow the protocols like everyone else who leaves the Atlantic bubble and comes back in. They'll have to self-isolate. But we will work with public health as we get closer to make sure that we communicate that message to university students who may choose to go home outside of the Atlantic bubble, and then, if there's any change to the protocol, we'll make sure they know that before they leave.
And I remain in ongoing discussion through my colleagues in the Department of Labor and Advanced Education with the universities. I believe next week I have another discussion with all the university presidents we were focused on the return to school. Now we were now starting to discuss in much more detail what January looks like and the Christmas break.
Next question will go to the Halifax Examiners, Tim Biscay.
Yeah, I'm not sure who wants to field this. We're wondering about what the plan is should there be an outbreak in a nursing home. We're hearing some discussion that there's at least talk of removing people from the homes and placing them in a regional care center, and some announcement is about to come out. Have you made a call one way or the other on this?
So I'm not aware of all the details, but certainly as part of the health authority's plan is, as you said, developing these regional centers and having transferring people out of individual facilities. But you'd have to talk to the health authority about where they're at with the planning on those.
The concern being raised by nursing homes is they feel they don't have enough resources to run their own operations, and this is going to take some of their staff potentially, or some of the resources, to go into these regional care facilities. So how will that be handled? Will they be made whole financially, or what are the details around that?
I don't have the details of that. We can work with continuing care and get you some of that through the department.
Next question will go to Global's Graham Benjamin.
Hey, I just had a question for Dr. Strang here. We know that Absolute Travel's kind of come up with this plan to bubble with this one resort. Is that a request you're fielding a lot from travel agencies? And have you received anything from outside of Cuba? Are these travel agencies considering other destinations? What have you heard from them?
I've had 3 reach outs from 3 different individuals all about this Atlantic Cuba bubble. And my answer to them is the same as I said in my remarks. First of all, the federal government is advising against non-essential travel outside of the country. Second of all, that it's under the federal jurisdiction about the 14-day quarantine period. So I've said to them they need to have their discussion with federal colleagues. But I've in my remarks, I gave my, you've heard my perspective on the wisdom of where people should be planning to take their vacation, spend their money, do it locally.
And for the online assessments, we know that's going to be available here right now. What's the reason for the delay for the other 3 zones?
It's simply because it's part of this rollout of the bigger piece around online booking for everything. So rather than trying to roll out 2 separate processes, it just made sense. And it's only a couple of weeks delay. It's within the next couple of weeks to do it as part of the rollout of the bigger online booking project.
Next question will go to Keith Doucette with the Canadian Press.
Hello, Dr. Strang. I'm wondering, your counterpart in PEI yesterday made an unequivocal statement about the actual Atlantic bubble, saying she didn't foresee any changes, at least through the Christmas period, in terms of the requirements and the isolation requirements. Are you prepared to go that far today, given that you highlighted the uncertainty around the pathology of this virus over the next little while?
So I'm not going to be as certain as Dr. Morrison. We continue to have conversations within Nova Scotia about what is the right approach as we start to think about the December and the holiday season. And I meet regularly with my Atlantic counterparts, and the Premier meets regularly with his Atlantic counterparts.
And the other thing is, you did briefly mention about the idea about perhaps reducing quarantine periods. We're not there yet, but is that something you think is important as we strive to try to open up the economy to a certain extent when we feel it's safe?
Well, we continue to look at how do we get the right level of COVID safety, but having things as open as possible. We know that the quarantine and the Atlantic bubble has been very helpful to keep us safe as we're at, but we need to continue to look at that as what is necessary. And we get, growing evidence from other jurisdictions around how does testing how could testing perhaps play a role in minimizing or reducing the quarantine. We're aware there's a pilot project now happening, led by the Public Health Agency of Canada in collaboration with the province of Alberta, where they're having a pilot project now of testing upon entry and then monitoring and then testing, and I believe it's day 6 again, rather than a stricter quarantine. So those kind of things we're anxious to learn from, and will continue to evolve as evidence evolves, the epidemiology evolves. Our goal is always to find what is the most appropriate balance of keeping things open, but also having the necessary level of safety.
Next question will go to Pierre with Radio Canada. Pierre, are you there?
Good afternoon, Premier McNeil and Dr. Strang. On the issue of Irving Shipyard, I know, Dr. Strang, in the past you have revoked exemptions that were given to some individuals. I'm just wondering how many of those were revoked, and what does it take for you to revoke an exemption that's given for someone to self-isolate?
So I believe in the case of Irving, I think it was 2 or 3 individuals that we were told they needed to stay, their executives needed to stay home. I haven't revoked any of the other decisions we've made, but clearly if we had evidence that there was non-compliance around whether it's a rotational worker or an essential worker or any other elements of the exemptions or exceptions we always have the ability to, if there's non-compliance that's brought to our attention, to go back and revisit and if that decision, and if necessary, revoke the exemption or exception.
Go ahead with your follow-up, Pierre.
Yes, thank you. And on the issue of online test booking, I'm wondering if it's your intention as well to have test results available online, like Prince Edward Island has been doing for a little bit now.
Well, for a couple of months now, if people are willing to provide an email, they can get their results by email. We certainly encourage people to do that. It's a much faster turnaround for them if it's a negative result. If it's a positive result, of course, they'll get a phone call very quickly. That's automatically reported to public health, and public health then, in a very timely manner, contacts that individual.
That's all the time we have for questions today.
Thank you, Chrissy. Before I get into the ghosts and goblins, I want to take a moment to reflect on Thanksgiving weekend. I want to say thank you to all Nova Scotians for following the protocols. We were worried that weekend might cause a spike, like we're seeing in other parts of the country. A number of our sister provinces are experiencing high numbers and are connecting it back to Thanksgiving weekend. This demonstrates, even when we were trying to be kind as a family, family gatherings, the virus can be cruel. We're thinking about families across the country and communities that are still dealing with COVID-19 and the significant outbreaks that we're witnessing. I'm grateful here in Nova Scotia on Thanksgiving weekend, you had your turkey and you followed the protocols. What more could we ask? It makes me so proud that we are all in this together, which now leads me to Halloween. Dr. Strang has already talked to you about it. It's a day in October where kids look forward to dressing up, playing trick-or-treats, and getting more than their share of sugar. Sounds like a lot of fun, doesn't it? I actually thought this year I might dress up as you. No matter what your costume you wear or how many doors you knock on, you need to follow all of the protocols. So when you dress up, make sure you wear a mask and not just a Halloween mask. And when you say trick or treat, make sure you're doing it from a distance. Dr. Strang and I want you to have fun, so please be safe.